Everyone, it's Dr. Sino again, and here I'm going to be talking more about the coronavirus. It's just to demystify, so a lot of things are coming up and a lot of fake news. What should we do at home? What should we not do at home? What do we wear a mask? Do we not wear a mask? So there's all these questions that a lot of people are asking me on social media, on different venues. I want to just share with you some information that's based on research and science. And I do really want you to do one thing for me. If you really learned something new today, share this video, because this video is there made from me and my team around me for you. We're here in the office today, despite the quarantine. We are quarantining ourselves as much as we can, but we're doing this video for you, so you could be home and be safe, and so we could all, as a community, as one tribe, to really eradicate this virus once and for all. One of the things we're going to be talking about today is how long is this virus going to affect the whole globe, actually. Other questions I get a lot is, how long does this virus stay on surfaces? How far do we have to be from one another? So they're really interesting things that we're going to be talking about. Also, ibuprofen, do we take it, not take it? If we do feel sick, what do we do? Do we go to the hospital right away? So these are questions I really want to help you get informed as much as you can, according to the science that we have and according to the World Health Organization. Now let's talk about the masks that you could buy from a pharmacy or online, and they're being sold out now. These masks are excellent for you to avoid spreading it to other people, but not to you getting the disease. So when you apply this mask, there are holes, unless this is the actual N95 mask that's being used by us healthcare workers, and you actually have to get it fitted, and you have to have a shaved beard to be able to allow it to work. These masks are useless to be getting the virus. However, they're very important for you from spreading the virus. What does that mean? If you are sick and you actually have to leave your home and quarantine for whatever reason, you wear this mask out of the courtesy of everyone around you, because that sneeze or cough stays in the mask and prevents the projectile of the aerosols that can contaminate other people, because the virus is found in those aerosols in your sneeze or cough. Other things, I see a lot of people wearing gloves. Now, gloves are also useless when it comes to contracting the disease, because if you wear the glove and then you touch the surface that's been contaminated, and then what you do is you touch your mouth, nose, or eyes, you're going to get infected. So if you are wearing gloves, just make sure that you're wearing them. Take them off before you touch your face. That's one other reason why a mask could be helpful, actually, because if you do touch your nose or face, you're kind of preventing the direct touch to those airways. So that could be also one way to prevent that. The antiseptic solution. So I recommend minimum of 70%, 70 alcohol contained into your antiseptics. You could get some hand sterilizers, you could get some alcohol swabs. These are all very useful. You could also get some stuff from the pharmacy called chlorhexidine or providine, iodine, for people that are allergic to the alcohol solution. This does kill the bacteria. So after you touch a foreign material that you're not sure if it's clean, do use this and it will disinfect your hands. This may be just a simple kind of trivial thing, but let me show you how to actually sanitize your hand. You actually want to put a good amount, get those nails in both sides, and get in between your fingers and hands and really get the whole hand. You don't have to do it for a good 7 minutes. Just make sure that you get all the surfaces until the alcohol dries up, and now you're disinfected. Now let's talk about the safe distance away from other people. So the recommendation by the World Health Organization is 1 meter. So this is to strangers. If someone gets a bit close to you, don't freak out. You don't have to, just be gentle, be kind. They're not going to infect you if they're really not super viral or infectious. Just try to respect that 1 meter as much as you can, but don't go crazy about it. So if we're feeling sick, what do we do? Do we go to the hospital? Do we call someone? Do we go see our doctor? Now, how do you know if you have coronavirus? Really, the only way you will know is if you get tested. But because the health system is being bombarded by people thinking they have the corona, you really want to be smart about it. So the signs and symptoms that initially people are presenting with is fever and a dry cough, not a productive cough, so no sputum coming out. If you have those and you have a positive travel history within the first 2 weeks, do present to the hospital. That's urgent. If you don't have those, really self-quarantine yourself. If you just have a runny nose, if you have a cough that's productive, you probably don't have the corona. If you do have fevers and the fevers are not getting better with the medications like acetaminophen, then you do want to seek medical help, and that's when you actually call the hotline. The hotlines that are present now are being bombarded by a lot of phone calls, so their wait times could be up to 4 hours in some places in the regions. So I really want you to inform yourself as much as you can, share videos like this, read online, and this is going to help the system be there for people that are really in need with this type of sickness. So we just discussed acetaminophen, or the trade name is Tylenol. How about ibuprofen like Motrin, Advil, Aleve? These are all anti-inflammatories, even aspirin. So the consensus and the science is not really clear about it, but anti-inflammatories like ibuprofen, they decrease the inflammation and they actually affect the immune system itself. There have been some reports saying that this decrease in the immune system can be affecting the way we fight the virus. So there's some doctors that are actually telling people try to avoid ibuprofen and take acetaminophen instead. The science is not very clear, but just, if you can take acetaminophen instead of your ibuprofen, do take that. A very interesting question that I get also is, how long does the virus live on surfaces? It really depends on the mutation of the virus, because viruses do mutate, and depends on the surface of the that we're talking about. For instance, it's been generally known that this coronavirus can live up to 24 hours on cardboard. So if you get any mail, that could be the range of duration of the lifespan of the virus. Now, what's one of the most common materials found in the Western world or in our cities and societies? Plastic, steel. And unfortunately, this virus lasts long on those types of surfaces, so around 3 days or so. And even in patients that have died from this virus, the virus is still infectious in the dead body. So really, it really depends on the surface and on the mutation of the virus. Now, can we contract the virus? Can we get sick by touching a surface that does have that virus? The answer is yes, unfortunately. And that's why we're really stressing the fact of self-quarantine, minimize your areas that you're going to be touching that contaminated surface, and also wash your hands as much as you can after touching those surfaces. Holding your breath. If you can hold your breath more than 20 seconds, that means you don't have the virus. Actually, that's not very true. So basically, if you have any type of lung disease, whether it's a viral bacteria or a bacterial pneumonia, or even asthma or any type of lung disease, you may not be able to hold your breath for a very long time, but this is not a very sensitive or a specific test. So really don't count on this test to know if you have a coronavirus or not. Basically, you have to go to the hospital to get tested if you have those things that I talked to you about before. Now, one of the big questions I get asked, how long is this going to take? When do our normal lives get back to normal? So really, honestly, the scientific community does not know the answer to this question. Some reports are saying wait a couple of weeks. Some people are saying wait a couple of months, even at the end of summer 2020, or even at the end of the year. So just to share with you, the reason why we are doing this self-quarantine social distancing is to flatten the curve. We really want to minimize the infectivity of this virus so we can all go back to our normal daily living. On a bright note, we are seeing the data from China, and the area where this disease actually started manifesting is that after a month and a half, people are going back to their normal daily lives. But just remember that they had a strict quarantine implemented. So that's why we want you now, and spread the word, because this is really up to you. Our governments are trying their best, but it's up to us as a community to spread the word and really flatten the curve and stop this spread by self-quarantining, because it could be a couple of weeks, it could be a couple of months. It all depends on us. Now, the last thing I want to talk about in this video is I really want to thank all those first responders, those people that are very brave. There are heroes actually that are on the front lines, risking their lives every day for getting infected for us, for our safety. So thank you very much for all those doctors, those nurses, the police, fire, everyone who's really helping the community. You're really making changes on a daily basis. So I just want to thank you very much on the behalf of the community. If you really enjoyed this video, please share it. If you have any questions, please, the comment section is there for you. We're here to answer your questions, and really, if you have enough questions, we can make another video also just to demystify some of those myths going on. Stay tuned for more videos. Stay safe.